The capture of the Afrika Korps in Tunisia in May 1943 brought approximately 275,000 German and Italian soldiers into Allied hands. Among them were German medical officers who would experience something unprecedented in military history: treatment as medical colleagues rather than merely prisoners. This is their documented story, based on historical records and verified accounts. The 1929 Geneva Convention established special provisions for medical personnel captured during war. These provisions would shape the experience of German medical officers in American custody. The Geneva Convention's mandate of equal treatment for prisoners meant they were paid American military wages, and officers could not be compelled to work. Medical personnel, specifically, could not be forced to perform non-medical labor and retained certain professional privileges. The United States, as a signatory to the Geneva Convention, implemented these provisions comprehensively. German medical officers discovered that American adherence to international law exceeded what they had experienced under their own military system. German POWs were usually shipped in Liberty ships returning home that would otherwise be empty, with as many as 30,000 arriving per month to ports in New York or Virginia, where they were processed for distribution to camps. Good treatment began with the substantial meals served during transport. The journey itself provided the first indication of American resources and approach to prisoner treatment. Unlike the cattle cars used to transport prisoners in Europe, German medical personnel travelled in actual passenger accommodations with regular meals, a logistical decision that nonetheless made a profound psychological impact. By late 1943, German POWs were distributed across numerous camps throughout the United States. Texas, with its climate deemed similar to North Africa under Geneva Convention requirements, hosted a particularly large number of camps. 3 more camps were authorized in 1943. Fort Sam Houston, San Antonio, which was little more than a tent city with 176-man tents for both POWs and their American guards. Camp Howes, Gainesville, and Camp Hood North, Killeen. The medical facilities at these camps varied but generally exceeded what German medical officers expected. Camps maintained infirmaries, and in some cases, substantial hospital facilities where German medical personnel could work. The most significant aspect of German medical officers' experience was professional recognition by American medical authorities. There were many cases of German doctors who had been taken prisoner working on Americans and captured American doctors given German wounded to care for. As a rule, captured physicians were treated as respected colleagues by their counterparts. One American doctor reported that he and German physicians freely taught and learned different medical procedures from each other. The American Medical Corps generally provided the same care to wounded German prisoners as to Allied casualties. This professional courtesy was not merely symbolic. German doctors were addressed by their medical titles, consulted on medical cases, and included in medical discussions. This treatment contrasted sharply with their expectations based on Nazi propaganda about American society. The medical facilities in American POW camps represented a significant investment in prisoner welfare. The Camp Butner Convalescent Hospital treated almost 14,000 patients. Besides rehabilitation, they offered social readjustment and guidance, technical and exploratory training, vocational guidance, and general education. With a staff of 2,200 by late November 1945, assisted by 414 German prisoners of war, those recovering would receive round-the-clock attention. These facilities served both American military personnel and POWs, creating an integrated medical environment where German medical staff worked alongside American colleagues. The quality of equipment and supplies in these facilities often exceeded what German military hospitals had possessed even before the war's destruction of German medical infrastructure. German POWs, including medical personnel, had access to educational programs that would have been remarkable even for non-prisoners. Almost every camp maintained a library of donated books and magazines, some large enough to do justice to an average high school. Camp Fannin, for example, maintained a well-stocked library of over 2,500 books with an 80% circulation rate. For medical personnel, this meant access to current medical literature and journals, resources that had been restricted or unavailable in Germany due to both wartime conditions and Nazi censorship of non-Aryan medical research. Some camps established remarkable connections with American universities. Report on Camp Butner from April 1945 counted 110 prisoners employed as mess attendants at Duke University and UNC. While these prisoners were employed in non-medical capacities, the university connection provided German medical personnel in the camp with unprecedented access to American academic medicine. These university connections, while limited, represented a level of integration between enemy prisoners and American institutions that would have been unthinkable in Nazi Germany. As the United States sent millions of soldiers overseas, the resulting shortage of labor eventually meant that German POWs worked toward the Allied war effort by helping out in canneries, mills, farms, and other places deemed a minimal security risk. For medical personnel, this often meant working in hospitals and medical facilities, where their professional skills could be utilized. German medical officers who volunteered for medical work received compensation according to their rank and position, as required by the Geneva Convention. This payment, while modest, represented recognition of their professional status, something that profoundly affected men who expected to be treated as defeated enemies. A different problem was presented by the increasing numbers of German POWs. At first, some nurses wondered if they were capable of putting personal feelings aside and providing these patients with the best care available. Moreover, official theatre hospital policy clearly placed the care of Allied casualties over that offered to enemy prisoners. Most nurses, however, quickly discovered that they were able to view these men simply as patients in need of care and treated Germans no differently than American soldiers. This professional integration occurred despite initial reservations and official policies prioritizing Allied casualties. The ability of American medical personnel to separate professional duties from national enmity provided German medical officers with a model of medical ethics that transcended political ideology. German medical personnel in American camps witnessed medical supply abundance that contradicted their experience of wartime scarcity. Basic medical supplies, bandages, medications, surgical instruments, were available in quantities that German military medicine had not seen since before the war. The pharmaceutical availability particularly impressed German medical personnel. Sulfur drugs, which had been carefully rationed in German military medicine, were used liberally. The introduction of penicillin to some facilities by 1944 represented a therapeutic capability that German medicine completely lacked. The medical treatment provided to German POWs met or exceeded standards for American military personnel. German wounded received the same surgical procedures, medications, and rehabilitation services as American soldiers. This equality of treatment, mandated by the Geneva Convention but often ignored in practice by belligerents, was consistently applied in American facilities. German medical officers observed and participated in this equal treatment standard, gaining experience with American medical protocols and ethical standards that would influence their post-war medical practice. Texas hosted numerous POW camps, creating a concentration of German prisoners, including medical personnel. Located on approximately 40,000 acres or 63 square miles in Granville, Person, and Durham counties, Camp Butner was a combat infantry facility and site of training exercises for an estimated 30,000 soldiers. German and Italian prisoners of war were brought to Camp Butner, where they served as cooks and performed various duties. The scale of these facilities and their medical components provided German medical officers with exposure to American military medicine at its most developed. The contrast with increasingly desperate conditions in Germany became more stark as the war progressed. The professional relationships that developed between American and German medical personnel, while constrained by the prisoner-captor relationship, nonetheless included genuine professional exchange. American doctors learned trauma treatment techniques from German colleagues who had extensive battlefield experience. German doctors learned about American advances in antibiotics, anesthesia, and surgical techniques. These exchanges, documented in post-war accounts and military records, represented a level of professional collaboration between enemies that was unprecedented in modern warfare. The role of nurses in American military medicine provided German medical personnel with insights into different approaches to medical care. American nurses had more authority and autonomy than their German counterparts, participating in medical decision-making and performing procedures that in Germany were reserved for physicians. German medical officers working alongside American nurses had to adjust to this different professional hierarchy, an adjustment that challenged their assumptions about medical practice organization. During World War II, space at the fort was made available for up to 1,000 German POWs. This took place on the 15th of September 1942, while POW camps could be built. Fort Sam Houston is known as the home of Army medicine and home of the combat medic. Fort Sam Houston's role as a major medical training facility meant that German medical personnel there were exposed to American military medical education and training methods. While their participation was limited, the observation of American medical training provided insights into different approaches to medical education. Dental care in POW camps, often overlooked in historical accounts, provided another avenue for professional interaction. German dentists among the POWs worked in camp dental facilities, maintaining oral health for thousands of prisoners. These dental officers experienced the same professional recognition as their medical colleagues. American investment in POW dental health, providing routine dental care rather than just emergency extractions, demonstrated a commitment to comprehensive prisoner welfare that exceeded Geneva Convention requirements. German medical officers participated in public health measures within the camps, including disease prevention, sanitation supervision, and health education. These activities exposed them to American public health approaches that emphasized prevention over treatment, a philosophy that contrasted with German military medicine's focus on battlefield trauma. The success of these public health measures in maintaining camp health despite crowded conditions provided practical demonstrations of American preventive medicine effectiveness. The American approach to mental health treatment particularly affected German medical personnel. Combat fatigue, what would later be termed PTSD, was recognized and treated as a legitimate medical condition rather than as cowardice or weakness, the prevailing view in German military medicine. German psychiatrists and psychologists among the POWs observed treatment methods that included psychotherapy, occupational therapy, and pharmaceutical interventions. This comprehensive approach to mental health contrasted sharply with German military psychiatry's punitive approach to psychological casualties. As the war ended, German medical personnel faced repatriation to a destroyed homeland. Many had spent 2 or more years in American custody, during which they had practiced medicine under conditions often better than they had known as free physicians in Germany. The repatriation process included medical examinations and health certifications conducted jointly by American and German medical personnel. This final professional collaboration reinforced the collegial relationships that had developed during captivity. After repatriation, about 5,000 Germans emigrated to the United States, and thousands of others returned later to visit. Many farmers recalled their POW labourers with admiration and even affection. Indeed, many farmers maintained warm friendships with them. Among these maintained relationships were professional connections between medical personnel. German medical officers who returned to Germany brought with them knowledge of American medical practices, organisational methods, and ethical standards. While difficult to quantify, their influence on post-war German medicine was significant, particularly in areas such as medical ethics, patient rights, and professional standards. German medical personnel's exposure to American medical education methods influenced post-war German medical training. The emphasis on practical clinical experience, the integration of basic science with clinical practice, and the systematic approach to resident training were elements that returning German medical officers advocated for in rebuilt German medical schools. Several German medical officers who experienced American captivity became prominent medical educators in post-war Germany, though connecting their teaching methods directly to their POW experience remains historically challenging without access to personal papers and institutional records. The experience of German POW medical personnel in America is documented through various sources: official military records in the National Archives, International Red Cross inspection reports, post-war memoirs and oral histories, contemporary newspaper accounts, camp newspapers published by POWs themselves. These sources, while providing valuable insights, leave many questions unanswered about the full extent of professional relationships and knowledge transfer that occurred. German pharmacists and pharmacologists among the POWs gained exposure to American pharmaceutical practice, including mass production techniques, quality control standards, and distribution systems. This knowledge proved valuable in rebuilding Germany's pharmaceutical industry after the war. The availability of medications in American camps, from basic aspirin to advanced antibiotics, demonstrated production capabilities that exceeded anything German pharmaceutical industry had achieved. This exposure to American pharmaceutical abundance influenced German medical personnel's understanding of what modern medicine could achieve with adequate resources. The exchange of surgical knowledge between American and German medical personnel represented one of the most practical aspects of their professional interaction. German surgeons, many with extensive battlefield experience, shared trauma treatment techniques developed through years of combat medicine. American surgeons shared advances in anesthesia, aseptic technique, and post-operative care. This bidirectional knowledge transfer, while limited by language barriers and security constraints, nonetheless enriched both medical communities. German medical technologists and laboratory specialists among the POWs worked in camp laboratories, conducting routine diagnostic tests and supporting camp medical operations. These personnel gained experience with American laboratory methods, equipment, and quality control standards that often exceeded German military medical laboratory capabilities. The systematic approach to laboratory medicine in American facilities, standardized procedures, regular equipment maintenance, comprehensive record keeping, provided models for post-war German laboratory medicine development. German radiologists and X-ray technicians among the POWs operated equipment in camp medical facilities. American radiology equipment, particularly its reliability and image quality, impressed German personnel accustomed to maintaining deteriorating equipment with scarce replacement parts. Safety protocols in American radiology practice, including radiation protection measures for both patients and operators, exceeded German military medical standards. This exposure to radiation safety influenced post-war German radiology practice. The International Red Cross played a crucial mediating role in German POW medical personnel's experience. Red Cross inspections verified that medical personnel were treated according to Geneva Convention provisions, including professional recognition and appropriate work assignments. Red Cross packages supplemented medical supplies in some camps, though American military medical supply was generally adequate. More importantly, the Red Cross facilitated communication between German medical personnel and international medical communities, maintaining some connection to broader medical developments. Many POW camps published newspapers written by and for prisoners. These publications, subject to American censorship but generally allowed considerable freedom, included medical and health content written by German medical personnel. These articles covered health education, disease prevention, and medical news, providing German medical personnel with platforms to maintain their professional identity and share knowledge with fellow prisoners. The newspapers, preserved in various archives, provide insights into German medical personnel's perspectives on their experience. While limited, some German medical personnel were permitted to conduct medical research in American captivity. This research focused on non-sensitive topics such as nutritional deficiencies among POWs or disease patterns in camp populations, allowed German medical scientists to maintain their research skills. The ability to conduct even limited research with access to laboratory facilities and statistical support exceeded what many German medical researchers had available in wartime Germany's deteriorating research infrastructure. Disease outbreaks in POW camps required coordinated medical responses that brought American and German medical personnel together in urgent collaboration. These epidemic responses, whether influenza, gastrointestinal infections, or other communicable diseases, demonstrated American epidemic control methods and public health responses. German medical personnel participated in these responses, gaining practical experience in epidemic investigation, containment measures, and mass treatment protocols that would prove valuable in post-war Germany's challenging public health conditions. German medical officers observed American medical supply management systems that ensured consistent availability of medical materials. The systematic approach to inventory management, emergency stockpiles, and distribution networks provided models for efficient medical logistics. This exposure to American medical supply chain management influenced German medical officers' understanding of how modern medical systems could maintain consistent supply even under challenging conditions, knowledge particularly relevant for rebuilding Germany's destroyed medical infrastructure. Treatment of combat wounds in camp hospitals exposed German medical personnel to American advances in wound care. The liberal use of antibiotics to prevent infection, advanced surgical debridement techniques, and systematic approach to wound documentation represented advances over German military medical practice. German medical personnel's observation of and participation in American wound care protocols influenced post-war German trauma medicine, contributing to improved outcomes for civilian trauma victims. American emphasis on preventive medicine in POW camps exposed German medical personnel to different medical philosophy. Routine health screenings, vaccination programs, and health education initiatives demonstrated prevention-focused medicine's effectiveness. This preventive approach, while not unknown in German medicine, received lower priority in German military medicine focused on battlefield trauma. Exposure to comprehensive preventive medicine programs influenced German medical personnel's post-war practice. American rehabilitation medicine for wounded soldiers impressed German medical personnel. The emphasis on returning wounded soldiers to maximum function rather than simply pensioning them as invalids represented a different approach to disability. German medical personnel observed physical therapy, occupational therapy, and vocational rehabilitation programs that exceeded anything available in German military medicine. This exposure influenced post-war German rehabilitation medicine development. American medical communication methods between professionals with patients and in documentation differed from German practices. The emphasis on clear documentation, patient education, and interdisciplinary communication provided models for effective medical communication. German medical personnel's exposure to these communication methods influenced their post-war practice, contributing to more patient-centered and collaborative medical care in rebuilt German medicine. The experience of German POW medical personnel in American captivity demonstrates that professional identity can transcend national enmity. The American Medical Corps' treatment of captured German physicians as respected colleagues, with whom they freely taught and learned different medical procedures, established relationships that outlasted the war. While the full extent of knowledge transfer and professional relationships remains incompletely documented, available evidence confirms that German medical personnel experienced professional recognition that exceeded their expectations and, in many cases, their previous experience in German military medicine. This professional treatment was not universal or without problems. Security constraints, language barriers, and the fundamental prisoner-captor relationship limited full professional integration. Some American medical personnel maintained professional distance, and some German medical personnel resisted American approaches. Nevertheless, the documented experience of German POW medical personnel in America represents a remarkable chapter in military medical history. The decision to treat enemy medical personnel as professional colleagues reflected both American adherence to international law and fundamental American medical values. The impact extended beyond individual German medical officers to influence post-war German medicine. While direct causation is difficult to establish, German medical officers who experienced American medicine in captivity contributed to post-war German medical reconstruction, bringing knowledge of American methods, ethics, and organization. The story of German POW medical personnel in America ultimately demonstrates medicine's capacity to maintain professional bonds even during war. In treating enemy medical personnel with professional respect, American military medicine not only adhered to international law, but also demonstrated values that transcended conflict. This historical example remains relevant for contemporary military medicine and international medical relations. The principle that medical professionals share obligations that transcend national boundaries, demonstrated in American treatment of German POW medical personnel, continues to guide military medical ethics and international medical cooperation. The German medical officers who experienced American collegiality rather than expected enmity returned to Germany with more than medical knowledge. They carried with them the experience that professional respect could survive even war, that medical ethics transcended ideology, and that former enemies could become colleagues in medicine's universal mission of healing.